Hi, Dr. Vicky here. So let's talk today about some anxiety issues because I think number one, a lot of people don't realize you can get that anxiety at any age. It's going to present itself in different ways in different age groups. So we're going to have a lot, some will overlap throughout the entire population. But for example, your 20 something is more than likely not going to have high blood pressure. Sometimes, they're not as prone as people, let's say, over 50. So that high alert system, that sympathetic nervous system, it controls blood pressure, it controls eye dilation, it controls sweating. So there's ways of your body coping with stress mechanisms. So those are geared to send signals when you are getting chased by a bear, so you can get a bunch of energy out to those muscles so you can run fast. So there's things that your body is not regulated to be in the high alert system all the time. So you're like, you can't sleep. So sleep is a big one for a lot of people. Restless leg. And I treat a lot of people with a lot of problems with their legs. And so what do we want to do is we want to pick up circulation. So I do a lot of muscle work and trying to get lymphatic to move throughout the system and doing different techniques for a lot of that. Now, posture plays a role in some of this as well. So when you're sleeping, a lot of people, if your posture is such that you're hunched forward and your head is straight out, a lot of times that's going to really affect how you're positioning your sleep. So it's going to be a problem. So you're definitely not going to get the best night's sleep. You may not be able to lay flat. A lot of people will have sleep apnea where their breathing mechanism is abnormal, and then they have acid reflux as a result of all of this. So they may clench their jaw and grind their teeth during the night. So all of these things are symptoms of a high alert system. Now, sometimes you can have an abnormal bite. And so there's different things where your jaw will click and pop. But if you're grinding your teeth or clenching your jaw, that's your brain's way of trying to process that energy, and it has to go somewhere. So when you're just moving through your day and you're super anxious, which patients will come in and I'll ask them questions, and they'll be going back and forth from one leg to the other, or they'll fidget. So those are all signs and symptoms that their system is in overload. So what do we want to do? We want to rebalance the two systems, and the other system is rest and digest, which I've had plenty of videos on that as well. So I'll probably be doing one very soon on rest and digest, because those two systems should be balanced, not one overworking, because it's going to shut the other one down. And so we don't want that. We want everything in our bodies to be within balance. So give Souder Chiropractic a call and see what we might be able to do with your high alert system, and maybe help to help your digestion as well.